Hey, it's Dr. Yazdan, and today is one of my days off. And on my days off, I like to just kind of look on the internet and see what's going on with just hair related stuff. And one of the sites I browse is Real Self. Real Self used to be a pretty good website. I think it's died down a bit, but we still find some interesting stuff on Real Self, and I try to see what's going on. This was a post I came across. Looks like this guy is in London or the UK, and he had a beard transplant. And when you look at what he talks about, he says that he's been paralyzed with regret ever since, and probably one of the worst things he's ever done in his life is having this beard transplant. And if you look at the photos, you can see all of this cobblestoning that he got on his face. And then if you look at this photo on the right, you'll see that it's a very, very unnatural beard line. And if you zoom in, you can actually see a lot of these grafts are really big grafts that were used in the beard. And unfortunately, this guy is looking for a repair or a correction. And it's sad to say, but this is basically uncorrectable. You are absolutely screwed if this happens to you right here and you get cobblestoning like this. I have spent the last 12 years trying to figure out how to make this cobblestoning go away and better. I've tried deep dermabrasions. I've tried lasers. I've tried electrocautery. I've tried chemical peels, acids. I mean, you name it. I have messed around with it because I get quite a few patients that come in with this kind of cobblestoning on their face, on their eyebrows, in their scalp. The thing with the scalp is you can cover it with hair. Same thing with the eyebrows. But on the beard, if you shave, this is how your skin is going to look for the rest of your life. And this is why it is so important to go to someone that knows what they're doing. I've never had this happen because at the end of the day, we know what we're doing. Now, this is a risk. It can happen. Somebody can heal this way, and that's just how their body heals, and it is a risk of a beard transplant. But if it's done properly, the grafts are proper, they are small, the sites are match the depth of the grafts, this should really never happen. And unfortunately for this guy, he ruined his life, ruined his face, and he probably really didn't go to the right place. I mean, he says he went to a top surgeon, but the whole process was negligent from the consultation. I mean, the reality is if you're unhappy with the consultation or you don't trust the doctor with the consultation, you should never move forward. Doesn't matter what the doctor's credentials are or anything like that. When you meet a doctor, you should feel very confident and very comfortable with them. And, that doesn't seem to be the case with this patient. And unfortunately, it led him down a bad path. So intuition is very important. Your sixth sense that's telling you something is not right is very important. Listen to it. But unfortunately, I want you guys to see this and understand that something like this is unfortunately really not repairable. We can make it better, but we can't make it go away. How I would fix this is I would do laser hair removal, get rid of all of these big grafts, get rid of the majority of it, and then I would do a proper hair transplant to cover this cobblestoning, and this patient would need to basically wear a short beard to cover the scarring that he received from a hair transplant or beard transplant. So guys, this is just kind of a wake-up call. Everybody does hair transplant surgery today, but not everyone's good at it. It's very important these days to really pay attention who you go to, and this is a perfect example. If you guys have any questions, reach out to us. Be happy to answer them for you. And